Hello everyone. Today I'm going to talk about anorexia nervosa. This is not only an eating disorder but also a serious mental illness that affects thousands of people around the world every year. It involves extreme behavior related to food, body weight, and self-image. Understanding this condition is important because it can have devastating physical and psychological consequences, but also because early recognition and support can save lives. Anorexia nervosa is a mental health disorder characterized by a distorted perception of body image and an intense fear of gaining weight. People with anorexia restrict their food intake severely, even when they are already underweight. They may see themselves as fat, even when they are dangerously thin. Actually, the word anorexia literally means loss of appetite, but obviously, in reality, many of these people still feel hungry. They just refuse to eat because of psychological fear and guilty. These items of anorexia can be divided into physical, psychological, and behavioral categories. Physically, the body begins to shut down when it doesn't receive enough nutrients. People may experience extreme weight loss, low blood pressure, dizziness, and irregular heartbeat. The skin can become dry, the hair may fall out, and the nails can become brittle. Women often stop having menstrual periods. The lack of calcium and other minerals can lead to bones or osteoporosis. And in some severe cases, anorexia can cause organ failure, especially in the heart, liver, and it results from a complex interaction between biological, psychological, and social factors. Biological, well, research shows that genetics play an important role. If a close family member has an eating disorder or another mental illness such as depression, anxiety, the risk increases. There are also imbalance in brain chemicals such as serotonin or dopamine, which the mood, appetite, and reward processing. And psychological, well, people with anorexia often have perfectionist personalities. They see extremely high standards for themselves and fear failure. Many have low self esteem and base their self worth of appearance or control. Emotional trauma, bullying, or family problems can also contribute to the development of this disorder. Socially and culturally, of course, the media influence is powerful. We live in a world where kindness is often associated with beauty, success, in discipline, and well, social media platforms, fashion trends, and advertising constantly promote unrealistic body standards. This pressure can lead vulnerable people, especially teenagers, the development harmful behaviors of distort self-perception using a specific criteria according to the Diagnostic and Statistic Manual of Mental Health, or DSM-5. The main features are: number one, restriction of energy intake, leading to significantly low body weight. Number two, intense fear of gaining weight or becoming fat, um, even when underweight. And number three, distorted body image. The person denies the certainty of their low weight or overestimates their own size. Doctors um, often work together to evaluate both physical health and mental state. Blood tests, BMA measures, and psychological estimates are part of the process. Anorexia nervosa is a complex and requires a multidisciplinary approach. It usually involves doctors, psychologists, psychiatrists, and nutritionists working as a team. Medical treatment focuses on restoring physical health. The aims include nutritional rehabilitations and monitoring vital signs to prevent heart or organ problems. Psychological, of course, is essential. The most common approach is cognitive behavioral therapy, which help patients identify and change stored belief about food, weight, and self-worth. And medication can also be used in some cases, especially when the person suffers from depression, anxiety, or obsessive compulsive symptoms. However, alone is not enough, so therapy and emotional support are Preventing crucial. Anorexia starts with education and empathy. We need to teach young people that beauty is not defined by a size or shape, and that health is more important than appearance. Schools and families should encourage open conversations about body image and mental health. Promoting self acceptance and realistic media message can make a big difference. If we notice that someone around us is showing warning signs like skipping meals, losing a lot of weight, or being obsessed with dieting, we should offer support and not criticize. Listening and encouraging them to seek professional help can truly save a life. Anorexia nervosa is not simply about waiting to be thin. It is a serious psychological disorder that affects both the body and the mind. It destroys our physical health and diminishes self-esteem, and can even be fatal in untreated. But recovery is possible with the right treatment, compassion, and early intervention. Many people regain their health and discover their self-worth. By raising owners, fighting to the stereotypes, and supporting those who struggle, we can help create a world where no one feels trapped by their body image. Thank you for listening.